Hi, I'm Dr. Joel Churadack. One of the questions that I've been asked lately to explain to our patients is, what are peptides and how do they work? If you're familiar with the weight loss drugs, and most people are, the GLP-1s like Mounjaro, which is tirzepatide, or like Ozempic, which is semaglutide, those drugs are actually peptides. And what a peptide is, it's a short chain of amino acids. So a chain of about 20 to 100 amino acids, whereas a protein is also a chain of amino acids, but those are hundreds of amino acids or thousands of amino acids long. So these short chain amino acids, which we refer to as peptides, actually mimic naturally occurring compounds in your body. And what these compounds do is they signal to your body to either enhance something or to calm something. So for example, with the weight loss drugs, let's talk about semaglutide, which is GLP-1, which stands for glucagon-like peptide. And what that is, it's a peptide that's naturally released in your gut and in your colon, and it tells your brain that you've had enough food and that your body doesn't need any more food, and thus that reduces your hunger and in turn reduces your weight. Tirzepatide works the same way. It's a GLP-1 plus another peptide called GIP, and they work synergistically to both affect your blood sugar and your appetite. So it has a little bit more of an enhanced weight loss effect. Now, there's another whole class of peptides that do all kinds of different things. So there's a class of peptides that are used that we call regenerative peptides. And what these peptides do is they mimic the compound that signals to your pituitary gland to release growth hormone. So they mimic what are called growth hormone releasing peptides. And so a couple of the more common ones that we prescribe are ipamorelin, you may have heard of, tesamorelin, and CJC 1295, or a combination of those three different peptides. And what those peptides do is they, like I said, signal to your pituitary to release growth hormone. And then you get the effects of the growth hormone, which would be increased lean muscle mass, better sleep, better energy, better healing, and better recovery. But the reason why we like to use peptides instead of, say, having a patient inject just straight growth hormone is because what the peptides do is they allow your own body to maximize the amount of growth hormone that you can produce without going outside of your physiological range. So there's no danger to it. It's just your body maximizing out its potential. So we really like that for its safety profile. You get all of the benefits without any of the risks of having an outside drug added to your body. Another category of peptides are also reparative peptides, or anti-aging peptides. And one of the main ones that we prescribe that's becoming more and more popular every day is called BPC 157. And what that stands for is body protective compound. So that kind of gives you an indication of what that peptide actually does. It was discovered in the gut, and it was discovered in the gut lining, and what it does, it repairs the gut, and it repairs gut tissue, and it repairs gut lining. But what was also discovered is that this same peptide, BPC 157, also can help vastly increase recovery time, increase the ability of your body to heal injuries like sore muscles, even torn ligaments. BPC 157 has a wide range of effects. So it can be used locally. It's injected with a small insulin needle. You can inject it locally if you have like a biceps tear or a biceps pull. You can inject it in that area. It's going to vastly speed up recovery time. Or a lot of patients use it for its general anti-aging effects. So it has the effect of reducing those aches and pains that we get as we get older. It improves sleep quality, and it just improves recovery overall. And the way that we administer that is by using the same similar insulin needle and just injecting it into the skin of the abdomen so it goes throughout the body. So these are the class of drugs, peptides. They're small chain amino acids. All they do is mimic your body's own compounds so that we can either kind of like a dial tune up something or tune down something without using outside drugs and without getting outside of your physiological range, so that there's a lot of safety with these compounds. One thing that you want to make sure of when you're utilizing peptides is that you're doing it under the direction of a medical doctor who has knowledge in how to utilize these compounds, so that you're utilizing them and getting the best result that you possibly can. If you have any questions about our peptide therapy, reach out to our clinics. Our patient coordinators will be more than happy to answer any of your questions.